Thank you very much, Ms. President. My question goes to European Hospital and Healthcare Foundation. I would just like to state that in the beginning of COVID crisis in 2020, almost anything was counted as COVID case. Later on, the rules changed and the statistics changed. So my question to you is about how European hospitals function in these early days and how they function up to this day. Were the hospitals paid for taking care of COVID patients by the government or by the insurance companies? Were the hospitals paid by some NGOs for taking care of COVID patients? Was there some kind of a special program with incentives for COVID crisis and COVID cases? If yes, in what countries of Europe? And do you know of any cases where hospitals reported a greater number of COVID patients in order to get more money from the government or insurance companies or anybody else? Thank you.
Sorry, Mr. Sinčić, sorry about the pronunciation. I'm not aware of places where the hospitals faked COVID patients. I'm not aware. It may happen, but I'm not aware, to be honest. What we have been looking more is the way, again, to compare members and to inform our members, how countries have been handling this issue of the way they receive money. In some countries, they receive a global envelope to organize the care during the year. That was COVID instead of other activities. But in most countries nowadays, it's through mechanism related to the kind of patients you receive, through diagnosis-related group of sort of funding by individual. Here, it totally changed the system. So we have been also interested to learn from some members of some good practices trying to avoid bankruptcy of hospitals, clearly, public or private, because of a lack of usual resources, financial resources. So there are plenty of ways to adapt system that are still in place today because again, this committee is important. COVID is not finished. It's still a pandemic. It's still increasing number of hospitalization in a lot of countries. So we still have to face also this reorganization of the funding of hospitals through different mechanisms. But again, it's so diverse, sometimes at regional level, national level, some with insurance, some state budget, that it's too complex to define clearly in 1 minute what is the situation. But there are good practices in place.